When I look at kind of my kind of origin story and I think about specifically some of the areas of my mom. So my mom was in the Peace Corps. She lived in Ecuador, and she worked with different groups within Ecuador, specifically working on education and different areas of and helping with farming applications within Ecuador. And then she came back to the US. She became a nurse and eventually went on to a program called the Vista program, which John F. Kennedy had started in Alaska, in which she was living on whaling villages with the Inuit populations as a nurse. And so, as a kid, seeing her slides, seeing the things that she was involved with, in the populations that she was involved with, I was just fascinated by that and just the exposure that came through those experiences. So some of the kind of core values that have been brought to me through those exposures and seeing some of those some of those things that my parents brought to bear, which I think carried on even with my dad as a physician. The many different groups that he worked with as a physician, and just hearing his stories over the years of people that were in need, and just to see from a work ethic what he brought to bear of just being probably one of the most compassionate individuals that I know. The thing that makes me passionate is to be able to use the experiences that I have of People Matter, and to be able to bring that to bear in a company that has so much to offer. Is to say, how can we be good stewards within Thermo Fisher Scientific of utilizing all these tools to actually address some of the inequalities that exist, to lower barriers for access, to give access to a more equitable testing around the world. And it might be a small microcosm of what I bring to bear, but I think I'm passionate about being able to do that, to try to on a daily basis to look for those opportunities that I can have impact. My name is Joshua Trotta. I am the General Manager of Global Health Equity and Emerging Markets at Thermo Fisher Scientific.